The first one is a clinical review of pain relief in general, called The Mechanisms and Application of the Anti-Inflammatory Effects of Photobiomodulation. In most cases, Dr. Michael Hamblin, who's the author of this clinical review, will be recognized and regarded as like the top photobiomodulation or light therapy scientist. He's from Harvard School of Medicine, Wellman Center for Photomedicine, and he has kind of written a number of these foundational red light therapy clinical reviews that lay a lot of the sightings for other papers that come in, this being one of them. So I'll read his entire abstract for this paper, which is photobiomodulation, also known as low-level laser therapy, is the use of red and near-infrared light to stimulate healing, relieve pain, and reduce inflammation. Secondary effects of photon absorption include increases in ATP, a brief burst of reactive oxygen species, and an increase in nitric oxide, and modulation of calcium levels. Tertiary effects include activation of a wide range of transcription factors, leading to improved cell survival, increased proliferation and migration, and new protein synthesis. There is a pronounced biphasic dose response whereby low levels of light have stimulating effects, while high levels of light have inhibitory effects. It has been found that PBM can produce reactive oxygen species in normal cells, but when used in oxidatively stressed cells or in animal models of disease, ROS levels are lowered. PBM is able to upregulate antioxidant defenses and reduce oxidative stress. One of the most reproducible effects of PBM is an overall reduction in inflammation, which is particularly important for disorders of the joints, traumatic injuries, lung disorders, and in the brain. Many reports have shown reductions in reactive nitrogen species in various animal models. PBM can reduce inflammation in the brain, abdominal fat, wounds, lungs, and spinal cord. And this paper goes on to describe exactly the mechanisms of inflammation reduction. So if you're interested in that aspect of it, it's a really wonderful, important clinical read.